A young girl decides to skip dinner. She ignores her grumbling stomach and her mother gently encouraging her to eat. "I just want to be thin," she thinks to herself as she chokes back tears. A college student consumes an entire bag of fast food hamburgers, stressing about upcoming exams. He runs to the bathroom and turns on the fan so his roommate can't hear him, forcing himself to vomit. A young mother locks herself in her room with a large pile of cookies and cakes and cries in shame as she binges and shuts out the screams of her children. These hypothetical scenarios all have one thing in common: eating disorders. Defined as a mental disorder that causes serious disturbances to the normal eating habits of the affected, eating disorders are classified as mental illness. They can also have serious physical symptoms, giving them the highest mortality rate of any mental illness. There are many types of eating disorders, but the three most common are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by little to no food intake or small, exact portions of very particular foods. Often severely underweight, the anorexic relentlessly struggles to lose weight with an intense fear of gaining weight. Many of those suffering from anorexia have a heavily distorted body image, and they focus on non-existent flaws or weight that doesn't exist. Severe symptoms of anorexia may develop over time, including but not limited to low blood pressure, anemia, and osteoporosis, or thinning of the bones. These symptoms can even escalate to infertility or brain damage. In contrast, bulimia nervosa is characterized by excessive periods of binge eating, followed by a purging behavior to compensate, such as induced vomiting, laxative abuse, or excessive exercise. The bulimic may be any weight, but they are not healthy no matter what their weight is. As in the case of anorexia, in bulimia is often seen low self-esteem and dysmorphic body image. Physical symptoms may include worn tooth enamel due to the exposure to stomach acid, acid reflux and internal distress, and severe dehydration. In bulimia, there is even a possibility of electrolyte imbalance so severe it can lead to heart attack. Binge eating disorder is very similar to bulimia without the purging behavior. The individual affected consumes large amounts of food, often followed by feelings of guilt that can lead to more binge eating. It is often characterized by severe obesity and leads to high blood pressure and heart disease. In recent studies, eating disorders have been strongly linked to depression and anxiety disorders and low self-esteem. Scientists have even discovered that there can be genetic tendencies that can lead to risk for eating disorders. Recently, glamorization of online trends such as the thigh gap, visible hip or collarbones, and the belly button challenge encourage eating disorders in at-risk teens. Societal pressure and the media push for acceptance based on a perfect body image, thin and muscular. In acknowledgement of this issue, Catherine Orzulik-Croner, Associate Professor of Social Work at McDaniel College in Westminster, Maryland, who specializes in eating disorders and women's issues, was recorded saying, "In general, the public reinforces this notion of thinness, and it is evidenced in the epidemic of eating disorders not only with models, but also dancers, gymnasts, runners, and many others. Not only do we see emaciated models, but even mannequins are undersized. The advertising industry uses computer-generated models or different body parts of different women, which promotes an extreme distortion of what the average woman really looks like. This epidemic cannot be corrected easily. However, bringing attention to the problem has the potential to prevent someone from developing an eating disorder and possibly save lives." Thank you.